Hello everybody, my name is Dr Hitesh Batavia from Ravenscourt Dental Practice in Hammersmith. Today I'm going to show you different ways of cleaning between teeth. Unfortunately, I cannot guide you as to what you should be doing because that needs to be clinically assessed, and then the best way to do it will be easier to explain, but I'll just cover the different ways of doing it. Of course, we all know about flossing and how we often can struggle with that. What I have found is these floss picks, they are very good and very easy to use, and I'm going to demonstrate. So what you do is you put that at right angles, 90 degrees between the two teeth, almost like a cheese string, and then press this so it's taut, and then seesaw it in. It gives you an immense amount of control. When you come to the bottom, just get gently, hug the tooth and gently under the gum, not painful, and there you go back and forth between 4 to 6 times. That will remove the plaque, which is a bit like peanut butter. Then you move in the same space to the opposite tooth and hug that, and under the gum again gently do that. Okay, and then come out. If it comes up very inflamed initially, you may find that this actually is a bit sore and it makes you bleed, and so you do need to make sure that you've sought attention of a hygienist and or a dentist, so they know what to expect. And then once it's all cleaned up, it's far easier. And then you just move it to the next tooth and next tooth, and you can almost go behind the last tooth as well. Now, the main thing to remember is that as you move backwards, to keep it 90 degrees, you need to orient the floss. As you can see, it's like this, and as I go back, it's like that. Okay, those who've got slightly higgledy-piggledy teeth, that sometimes makes it a bit more difficult. You can use the normal floss, we all know about that. Again, you can use a similar technique. Sometimes it's about dexterity and whether you can actually get right to the back. Second, it's a question of, do you have the time to be in front of a sink to wash your hands and things like that. So I prefer this on that reason that it can be done anywhere. The third thing that is using TePe brushes. So you can get them like that, or you can get them with handles. And there are a few other ways of doing this as well, which I'll show you. It's the same principle, just different instruments to achieve the same thing. So what I do is I normally find where the space is. So you do need to know where the space is. This tip is not going to find the space for you. You place it, you gently go between your teeth, then gently press on the gum there, hug the front tooth, go back and forth 5-6 times, back tooth 5-6 times. On the top again, it's exactly the same. Push it in and do that. And you can use different sizes for different spaces to be able to ensure that you kept the area much cleaner. Again, to begin with, you'll find a bit of tenderness and sometimes a bit of bleeding. Please always make sure that you have seen a hygienist or a dentist so they can guide you correctly as to which sizes are correct for you. Or you can have one with the handles, and you can again make sure that the brushes sizes are the correct ones for you, and then again you can gently go in and clean between teeth. Now, or you can have what I call the Curaprox brushes, where you can actually put the heads on into the hole there, and they can work, and they come in different sizes as well. So this is another very good way of doing it as well. And for those who want to clean well behind a wisdom tooth or crooked front teeth, an interdental brush like that helps as well. So that's what you go. It's quite a tough brush, so you need to sort of get used to it, because initially you'll find you're going to hurt yourself or make yourself a little bit sore, and that helps. All these things are what I call part of a gum gym routine. As you use it, as the gums get healthier, they get tougher, they don't feel so sore, they don't feel so bleedy. Again, as I've said earlier, always seek the help of a hygienist or a dentist so that you know what is appropriate for you. But these are just guidelines that help you to take the myth away from how to clean between your teeth. I hope you found this useful, and if you have any queries, we're very happy to help.